Hi, I'm Liz Herman from Sherpa financial planner in Pennsylvania, and I have a really important question that I'd like to ask Susan Sloan today. One of my clients just changed jobs, and his new employer offers an HRA for their health insurance for their employees. Susan, can you tell me about those?
Yeah, HRAs are health reimbursement accounts. And when an employer now is offering a health reimbursement account, there's a couple of different ways it can be. It typically was a way that employers in the last few years have been able to put money aside to cover medical expenses. Typically, they're using a higher deductible plan and the employer's putting money away to cover medical expenses. But employers in the last 2 years have not been able to pay towards premiums. Now in 2017, there was something called the Qsehra, Qsehra. And now, more importantly, and much more, I think it's making a much bigger impact, is the individual coverage HRA, individual coverage health reimbursement account, which can not only reimburse medical expenses, but the employer can reimburse premiums as well. And it can be done for full-time employees of various classes, part-time employees, 1099s, seasonal employees. There's a wide range. We could go on. And you can determine different classes. So with an employer, they may say, we're going to offer group coverage to our administrative staff, but we are going to our hourly workers, we're going to offer an individual coverage HRA. And that is tax advantage not only to the employer, but to the employee as well. Basically, what that does is it gives people the ability to have the employer, not only for their young employees. The Qsehras didn't work out too well because there was a maximum contribution level. But with these Ichras, there is no maximum contribution level, and there's no age requirement. So it works not only well for young employees, but for those who are on Medicare. You can have your employer can be reimbursing premiums for Medicare as well. And they can determine whether they want it to cover the premium only or whether they want it to cover the premium and medical benefits. There's a letter that they have to draft that has to come out 90 days in advance of when they're going to start offering this, that basically details how much they're going to give you and how they want that money to be used. But then you can use that. And if your income is low enough, you may still qualify for a tax subsidy as well through, in this case, Pennsylvania's new penny marketplace. So there's a lot going on with that. Have you either of you run into that situation yet, or talked to anybody who's instituted an individual coverage HRA?
All I know is my client, his employer puts a certain amount of money into this, but I think they also have some sort of underlying coverage.
Then what they're offering, they're offering a group health plan. And then an HRA is an employer contributed, kind of like an HSA. It's an employer contribution where the employer can put money in. Say you have a $3,000 deductible. The employer can put $1,500 towards that, so that the first $1,500 is not coming out of your pocket. It's coming out of the employer's pocket. They're getting tax advantages on it, and you're not having to pay the money. So it's out of your own pocket for medical expenses. It's typically combined with a higher deductible plan.
Got it. So what's the real difference between an HSA and an HRA?
HRAs are employer owned. If you leave the company in the middle of the year, those funds go back to the employer. They are not yours. If it's an HSA, on the other hand, typically, while an employer can contribute to it, typically a lot of times the employee is contributing, and that money is yours. And depending on the amount of money that you have put in there, and you determine that how much you want taken out each month or each week or whatever pay period, and that money can be used for medical expenses that are covered under your health insurance. It can be used for things that are not covered. So say you didn't have dental insurance. You can still use pre-tax money in order to pay for that dental. So if you're paying with pre-tax dollars, you're paying a lot less money than you would have been if you were paying with after-tax dollars.
Sue, and just to speak on that, remember that if you do not take advantage of your employer's pre-tax dollars, there's a 7.5% limit that you have to reach first, a threshold that you have to meet first, if you are even able to itemize before you can take those deductions. So for many people, it is more advantageous to look at pre-tax dollars through your employer than to try to take it on your tax return.
Right, yeah, it is.
And I have a question. Are there income limits or contribution limits on these HRAs?
So I'll let you.
I believe for 2020 it's $4,350 for a person on who to contribute into an HSA. That's the maximum. If you are 55 or older, you can add $1,000 catch up. So for someone 55 or older, $5,350, and that reduces your taxable income by the amount that you have deposited into your health savings account, which is actually a bank account. Mm-hmm. It's in conjunction with a high deductible health insurance plan, but the HSA is actually a bank account. Mm-hmm. So anyhow, if you have questions on this, please get in touch with us. I'm Susan Sloan from Real Health Quotes.
Liz Herman, Sherpa Financial.
Colette Mellott, CM Business and Accounting.
Have a great day.